I'm Monica Ebsary, and I live in Dartmouth, Nova Scotia. And I came to Canada in December 1981. My mother had remarried and had moved to Canada and then I came a few years later after I'd gone through the immigration process. And I'm a full-time dental receptionist, and my husband is an Anglican priest, and we have 2 daughters in their early 20s. And I wish to share my own healthcare story with you briefly. Since I came to Canada, I had my 2 girls and had exceptional care, prenatal and postnatal. A wonderful experience at the Grace Maternity Hospital, giving birth to both girls. And I did suffer postpartum depression after giving birth to my daughters. And I had an excellent physician at that time who referred me to a specialist for that and had excellent care for that depression. During the years, I've also dealt with allergies due to the work that I do in dental offices. I was also diagnosed with a spinal disorder, genetic one, which I've had to wear a back brace for in the past, and physiotherapy. And I also had a hysterectomy after my second daughter. And then my biggest challenge was in 1999 being diagnosed with Parkinson's. And since that time, I've been able to be followed up by the Parkinson's Clinic in Halifax. And Halifax, Nova Scotia is a leading center for Parkinson's research. And I have a wonderful neurologist also looking over me, making sure everything's going well. I feel I get exceptional medical care in Canada, and I'm very grateful for that. I wanted to speak about my own health story, mainly because I visited the States just recently, my cousin in Seattle, and we had an interesting conversation with her coworkers too over dinner about the healthcare issue. And understandably, there's a lot of concern about the proposals from President Obama and what he hopes to implement over stages with the new healthcare reform. And many people who have health insurance, I believe, are worried that they're going to lose something that they already have. And from listening to President Obama's speech to both the House and the Senate, if you listened carefully, he hoped to implement that change over time, which, looking back at the history of Tommy Douglas and how he brought health care to Canada, that was also how they did this in Canada, was in stages over time. And I believe it's something to treasure here in Canada because no one is denied by race or income level or any other conditions to have basic medical care. It's considered a right and a principle of Canada that everyone should have health care. And that's very, very important to me and my family. Thank you.